As unemployment increases, so does the number of people looking for mental health care. And due to the lack of insurance, public centers are being swamped with new cases.
What we're finding is many of the people are coming into public mental health as a result of not having health insurance, losing their employment and not having that, once being seen by private providers, no longer able to afford the coverage of that, and now having to come into public mental health, thus increasing the caseload sizes tremendously.
As a result, Tisha worries new patients might be suffering the consequences by risking not getting the proper attention their case requires.
Are having to absorb more people, and it is very difficult because when you're one person and you have a 40 to 45 people caseload, it becomes difficult to meet the needs of each individual person.
46-year-old Christine Yapster is one of those cases. She is currently unemployed and being treated for depression.
My decompensation specifically meant to me that I was crying for over 4 hours straight. I could not stop crying. I was in deep, deep depression. I could not see any light at the end of the tunnel. I couldn't see the tunnel.
And although she is now getting the professional help she so badly needed for her severe depression, she is also learning to cope with the added stress of the economic recession.
It adds a lot of stress. It adds a lot of stress because I realize that money is going faster than it was before.
Like Christine, there are many unemployed clients coming every day to this facility, an increasing patients that comes at a time of budget cuts. As many as 32 states are cutting funding, reducing services, closing programs, and imposing hiring freeze.
Andrew Sperling, it seems like something's got to give. If we're at a time of added demand, places that provide this kind of service either have to serve fewer people or serve more people with less service. I mean, there's no other way to do it, is there?
Yeah, this is a system, Ray, that was already overburdened with its pre-existing responsibilities for individuals with severe mental illness. And to add on top of that, essentially this new caseloads and new demand for services places an already overburdened system at extreme risk.
But apart from saying, gee, that's too bad, that's a terrible situation, what do you do when you've got people who are clamoring for what you provide and you can't provide it?
Yeah, it's enormously difficult. Now, there's some modest help on the way. Dr. Sherman mentioned earlier the new law that's going to require private health plans to cover mental illness and addiction on the same terms and conditions as other illnesses. We've gotten some help in the present stimulus plan, particularly with Medicaid financing, which is the largest financing source for public mental health services in this country. There was help in the present stimulus plan to stabilize Medicaid programs at the state level, but there still is enormous strain on this already overburdened system.
Particularly the safety net system that was referenced in that piece. You know, the federal government has a block grant program on mental health and substance abuse side that helps underwrite the safety net system in this country, but it is pretty frayed. And so it becomes increasingly difficult for people to access services.